Coming up on ncIMPACT, crime and public safety are among the issues that have taken center stage across the country. We'll find out how communities are working to make their neighborhoods safer.
ncIMPACT is a PBS North Carolina production in association with the University of North Carolina School of Government. Funding for ncIMPACT is made possible by
changing the course of people's lives. That's the impact UNC Health and the UNC School of Medicine work to deliver every day. Our 40,000 team members across the state of North Carolina are committed to caring for you, our patients and communities, as well as educating the next generation of healthcare professionals. Individually, we can do a little, but collectively, we can do a lot to create impact.
Welcome to ncIMPACT. I'm Anita Brown-Graham. Violent crime rose in North Carolina from 2018 to 2020, then slightly dropped in 2021. This comes after a steady decline in violent crime in the early to mid-2000s. It has many communities grappling with how to make their neighborhoods more safe. ncIMPACT's David Hurst joins us with a story of one North Carolina family impacted by community violence.
Anita, it's estimated that 85% of youth in U.S. cities will be exposed to community violence in their lifetime. ncIRIC Horn's exposure to community violence came at a young age of 12. This is a story of a family whose lives have been changed forever, but it's also a story of resilience and hope.
Come on, Matt, Daddy.
This is normal life for Tamika Horn and her son ncIRIC. It's been this way ever since 2014 when Tamika got the call from a Rocky Mount police officer.
So he was like, ma'am, I'm sorry. I was like, and he was like, I'm sorry to tell you, your son's been shot. So, I almost passed out.
ncIRIC was playing basketball at a park near their home when someone drove by and started firing shots. ncIRIC, who was 12 at the time, was shot in the head and rushed to the hospital.
The sight I saw, wow. My baby had been shot. It was a headshot. It took one of his eyes out.
Doctors initially said ncIRIC would be paralyzed and non-responsive for the rest of his life. But after just 3 months of recovery, he started showing signs that even surprised the medical staff.
But he did just that. Because by the end of that week, he responded. And he went to rehab.
While ncIRIC has slowly gotten better over the past 9 years, Tamika Horn says crime in the community seems to be getting worse.
Because it don't make no sense when they shot a child, and they done shot plenty of children around here, and it's not changing. I don't understand.
Crime rates spiked across the United States in 2020. The most recent year numbers are available. The murder rate rose by 30%, and the rate of assaults jumped up 10%.
You let your brother drive to the gym.
For Horn, she tries to stay optimistic that things will get better for her community and other communities struggling with community violence.
Go around there. Go and drive around there and get your nerves.
She says her son has taught her what it means to hold on to hope.
This is a child, and he endured that. He had just turned 12. He had just had a birthday that December. And it happened to him in that January. But he is my inspiration. He is my shining star. Him.
This hope has become a main part of Tamika Horn's normal life because every day she has a reason to smile and a reason to believe things will get better. This past year, the city of Rocky Mount declared a state of emergency on crime. And in May, the police chief asked a federal task force to come in to help.
Thank you, David. Joining me now is Stephanie Hawkins. Stephanie is Vice President of the Transformative Research Unit for Equity at RTI International. Stephanie, let's just start by acknowledging that that was a heartbreaking story.
Yeah.
And while we often focus on crime in big cities, help us understand how common are these types of stories in communities that are mid-sized or small?
Yeah, thank you, Anita. Community violence is a critical public health problem. It happens literally everywhere, big cities, small cities. So we have to really appreciate that this issue is something that all of us need to be invested in.
Thank you. The physical cost, obviously, for this young man are clear in that story, but I want to lean into your background as a psychologist for a moment. Even if you heal completely physically, talk to us about the kind of lifelong impacts being a victim of community violence might have.
Yeah. So when we think about community violence, we can, and thank you for bringing in my psychology background, that we often hear post-traumatic stress disorder. But for people living in communities experiencing violence, there often is no post. There is no post to the trauma that many community members experience. So what we think about for the impacts for young people in particular are the trauma that's associated with it, and it is lifelong trauma. It really is about the fear that people have either from being a victim of violence or the fear of being a future victim. And then, of course, there are physical health challenges as well.
So I think I hear you saying we have to be concerned about the victim, but that these impacts actually extend to the entire community. And can you unpack that a little bit for us?
Absolutely. So when you're living in communities that experience violence, you have to also think about what services are available in those communities, what businesses want to come and invest in those communities. So from a community perspective, you experience a strain on systems, both education, justice system, but particularly the medical system.
Thank you, Stephanie. We'll come back to you in a little bit to talk a bit more about these wide-ranging effects and what it is communities might do to respond to them. Now we'll turn to a crime prevention program in Cabarrus County, which is seeing success in reducing violent crime rates. This program is a partnership among federal, state, and local agencies. ncIMPACT's Andrea Corona shows us how the program is making Cabarrus County a safer place to live.
When Project Safe Cabarrus began in the mid-2000s, local law enforcement leaders quickly noticed violent crime rates plunged 60%.
Our county was one of the ones that the feds would bring others into to kind of watch and learn and ultimately mimic because we were having such great success.
Project Safe Cabarrus helps former prison inmates turn their lives around.
We've identified that you're a problem in the community, but at the same time we offer solutions through different programs, community-based organizations to say, if you want to turn your life around, we've got folks here today that's willing to partner with you.
Law enforcement officials say former inmates often return to crime because they can't reintegrate into society.
We started to work with them in the jail, trying to give them things, incentives to look forward to through the Career Center, through Opportunity House and the Cabarrus Reentry Initiative, that they can go and get help.
They can also get IDs and documents that they'll need to restore their lives. If a person commits a new crime, the program doesn't give up on them.
When somebody is notified to give them that second chance, if they happen to reoffend and they find themselves back in here, we want them to feel like we're still going to work with you. Our community is still out there to help you.
Project Safe Cabarrus is part of a federal program where law enforcement agencies band together and partner with federal officials to address gun violence.
Sometimes we can't reach 50 people, but if we can help one person, that helps our community, that helps our county.
It's work that redefines our criminal justice system and is providing a better way forward for those with a criminal past. For ncIMPACT, I'm Andrea Corona.
Thank you so much, Andrea. Joining me now is Rob Lang. Rob serves as an assistant U.S. attorney with the Middle District of North Carolina. Rob, your office started the Project Safe Neighborhood Initiative, which Project Safe Cabarrus County is part of. Before we get into that, though, I want to get personal for a moment. What goes through your mind when you see that story and see the success coming out of the Cabarrus County effort?
Well, it feels Great. It feels, after being part of the system for 32 years as a prosecutor, to see some success that's been sustained is very heartwarming. It's also good to see new leaders. The new sheriff has embraced this strategy, as well as several new chiefs, and they've kept it on and sustained it through the years.
That's wonderful. And that's what you want with these partnerships, is sustainability beyond the individual people who get started. So tell me, from your perspective, what is the secret sauce to the Project Safe Neighborhoods strategy? What makes it work?
The secret sauce is the partnership itself, and the partnership is driven by data, though. The good data that informs all the law enforcement agencies, the probation partners, the NC Works, the Department of Social Services, all those partners use that data to pinpoint and focus their services and what they do on that population.
So, Rob, let me ask you this question. There are no limit to media stories about law enforcement initiatives that have gone awry in terms of targeting particular individuals. Help us understand what's different about this program. How is it different from those kinds of programs?
Well, I think the data makes it defensible, and there's a great effort to continue to make sure the people that are identified to be prosecuted qualify, and that we talk with each other, we work with the community, and we're listening to the community about these types of stories when maybe somebody who didn't have a history of violence is prosecuted. So we're very attuned in this partnership to listen to each other. We're engaged, we meet, we have regular meetings where we talk and make better decisions because we have better information, and all of our efforts are based on that data.
Thank you for that, Rob, and we'll come back and talk a little bit later about this incredible program and what you see for the future of it. Youth crime in North Carolina is trending downward, but more juveniles are being charged with crimes involving guns. ncIMPACT's Evan Howell visits Robeson County, where a multifaceted approach toward reducing youth violence is taking shape.
A little bit, okay.
Growing up in Lumberton, Jadarian Chapman had some positive influences in his life, but then he started leaving those connections behind.
I mean, I started going down the wrong road probably like 8th grade, 9th grade year. Yeah, that's when it started going downhill.
But then he met Leon, who's called a violence interrupter. Leon was an ex-gang member and became someone Jadarian trusted.
These kids out here every day, they hollering for help, they crying. Do we know the sound of cry? Do we know the sound of help? What makes me a little different, I done walked in their shoes.
Burden runs the Colors of Life program, part of a collaboration under the Robeson County Community-Based Crime Reduction Initiative.
All right, I got you.
This program provides community-driven, evidence-based techniques like the Violence Interrupter program to help resolve issues before conflicts escalate. It's based on successes in Chicago and Baltimore, but has never been applied to a rural area before.
Unfortunately, sometimes our law enforcement doesn't have that kind of rapport, but our violence interrupters will have sort of engagement with youth and try and hook them into alternative programs.
Where's that going to be at?
Mike Brill is a well-known retired football coach in Robeson County who now serves the initiative with his own approach by recruiting students into athletics.
If I had a player that I thought was in a gang, and at this time, years ago, I knew Leon, and I would call Leon knowing he was a former gang member, and he knew what gangs these kids were in. And so if I had a kid that I know was possibly in a gang or going to be in a gang, I had him involved because those kids would listen to him.
Jadarian Chapman is thankful for Leon Burton and his guidance. He says without that intervention, his life may have been different.
He's a real role model, so if it wasn't for Cuz, like, man, I'd probably be, in the streets, even farther. Like, I'd be doing stuff I shouldn't be doing, but at the same time, that's why I'm grateful for Cuz, like, because it changed me a lot.
The Violence Interrupter program is just getting started, but to date, the data is promising. That's good news for Jadarian, because with a 2-year-old daughter, he's looking forward to guiding her to a positive future. For NC Impact, I'm Evan Howell.
Evan, thank you so much for that story. Let's bring back our experts. And joining us for the ncIMPACT Roundtable is Robin Jenkins. Robin is the Associate Director of the Impact Center at Frank Porter Graham Child Development Institute. Robin, we'll start with you. You are an implementation scientist. So tell us, what should communities be thinking about if they're interested in implementing the kind of strategy we just saw in the Violence Interrupter program?
That's a great question, Anita. Communities, I think, have to really come at this with the idea that there's no single program, there's no single answer to community violence. It takes a multi-layer, multi-strategy approach. So communities interested in this idea need to engage grassroots organizations with lived experience. The whole idea around public health approaches using credible messengers and violence interrupters works well because they are focusing on changing social norms. And those norms are all contextual to those local communities. So when you engage those local voices and you bring the evidence into the community and work with them in their context to apply it, and then use data, like Rob was talking about earlier, as well as some more evidence-supported strategies around not just focusing the deterrence effect on the crime itself, but bringing the resources and the supports into those communities that address the structural issues that enable that violence to occur to begin with.
And so, Robin, can you tell us whether in your work you've seen other evidence-based programs or ingredients of those programs that you would suggest that people look at as they think about what is the right collaboration for their community?
Well, the evidence is really compelling for things like cure violence. There's a great program out in California called Advanced Peace. All of these have characteristics that are sort of in common with what defines success. This idea that you're using these credible messengers that bring in this local community context, that it's a combination of deterrence, which involves law enforcement and prosecutors, but also those community voices that bring a willingness to open their stories and their voices to listening and bridging the conversation between those who may be at risk of or actually engaging in violence and those who have solutions to the problems. So it's that multi-layer strategy. There are a lot of other components to it around the use of data and feedback, designing it within the context and making sure that you accurately define the space and the boundaries for where you're going to do the intervention. Many of these programs have great visions, but they try to get too big too quickly. So you really want to focus the effort in targeted communities because violence tends to cluster in communities.
I see Rob nodding vigorously. Rob, do you want to weigh in on this?
Well, Robin was talking about the frontline workers. We try to identify in our locations those frontline workers that would do this work for free. They're already out there, and to help build their capacity, to assist them in applying for grants so they can build their programs incrementally. But I agree so much with what Robin's talking about that it has to be the multi-layered, frontline-based types of efforts to work.
Stephanie, we've been talking a lot about interventions. What do you do when you've identified individuals who you want to help make a different set of choices in their lives? But let's talk about prevention for a moment. How important is prevention as we have this conversation about crime and public safety?
Right, thank you. At the heart of this, we talk about engaging communities. We have to settle on the reality that community violence is preventable. So that's the starting point. And it is critical because a lot of these interventions could be avoided if we really think about a preventative approach, both for the individual, and I agree wholeheartedly with Robin that it takes a comprehensive approach, but we have to really focus in on individuals, both people who cause harm and people who are harmed, and thinking about strategies that can prevent the engagement in violence, but then also really focusing on the structural factors because communities don't themselves create the circumstances where violence is available.
So let me pick up on that and focus in on what communities can do, those solutions. Rob, obviously the program in Cabarrus County is focused on creating really strong partnerships among important stakeholders. Can you help us think about who are the stakeholders? Stephanie has said community needs to be an important stakeholder. We obviously know law enforcement is an important stakeholder. I've heard you say community volunteers. Who else are the stakeholders, and how do you build that kind of collaborative capacity?
Well, certainly the schools and the Department of Social Services are important partners in this effort to share information, what information can be shared. But the probation partners and the people that supervise our youth that are coming back from youth detention centers as well as the prisons, they're critical. Our hospital partners, some of the promising hospital violence intervention strategies that have been across the country and that we're trying to model in some of our cities. So all kinds of partners that bring their area of expertise to address and focus on the issue of violence and the recidivism and the recurring violence that seems to occur.
Robin, jump in here. Let's look at the flip side of the coin. We've seen communities that are doing collaborations well. What's at stake for those communities that aren't finding connections with other stakeholders around this issue?
Well, I think, again, Stephanie mentioned this public health approach. We have great data that violence is contagious. It tends to go where social order breaks down, where there's opportunity for crime and violence to occur. But violence is not a unique phenomenon. It's not one thing. There are a lot of reasons why people commit violence. There can be intrapersonal violence. There can be criminally and, sort of instrumental violence to achieve material gain. There's a host of reasons why people engage in violent behavior. So when people fail to take note of those factors that are traveling with violence, whether it's economic challenges, problems with sort of the structural supports, housing, effective education systems, early childhood programs, the things that make and bring healthy families and communities together, that build resilience among children and families. If those things are missing, then you're creating a real opportunity for, for people who have their own self-interest or organizations that have their own self-interest. And usually those are built around criminal opportunity or instrumental crime, instrumental violence.
I'm going to close this program, let me confess, deeply disturbed by knowing that there is a young man in Rocky Mount whose life is forever changed. It feels appropriate for me to ask each of you to give us some reason why you are optimistic that we will be able to turn the trends around. I'll start with you, Rob.
I am optimistic. I've been involved in multiple partnerships with rural departments, with urban areas, and have found that people have learned when they work together that they have the same interests. They want to be safe, they want to have good schools, and they want some economic opportunity. And that we have more in common than we think. And when we work together on a project like saving our children and saving our communities and reducing violence, those commonalities come together, and we can do something about this. And I'm not giving up. And I know the other panelists aren't going to give up. And there is evidence out there of potentials for success. So I have great optimism that we will overcome this issue. It's a tough issue, but we will overcome it.
Thank you. And Stephanie, Robin, can I hear from you all quickly too, please?
Yeah, I'll be really clear. Violence is preventable. So that is exactly why I'm optimistic.
Thank you. Robin?
Ditto to both comments and commenters. There is rich evidence that violence tends to be, although statistically small, it's very impactful. And, it gets exacerbated by media and the coverage that tends to emerge when it happens. But overwhelmingly, people are good and communities are good, and they want healthy children and families and systems that nurture those outcomes. And so I really believe that with the tools that we have at our disposal and a prevention mentality, we have a really positive outlook when we take this on.
Stephanie, Robin, thank you for that, and thank you for joining us, and obviously for the important work each of you do to support communities in North Carolina. And today I want to say a special thank you to the local communities that are featured in this episode and the people who so generously allowed us to share their inspirational stories. And of course, we don't ever end this program without thanking you, our amazing audience, for watching and engaging. You know solutions are out there if we work together. We want you to tell us what your community is doing or how we can help you. You can email us at ncimpact@unc.edu or send a message on Twitter or Facebook. And be sure to join us every Friday night at 7:30 on PBS North Carolina for new episodes of NC Impact. Coming up on NC Impact, workforce needs are growing in our state. We'll find out how communities are creating solutions for both employers and their future employees.
NC Impact is a PBS North Carolina production in association with the University of North Carolina School of Government. Funding for NC Impact is made possible by
changing the course of people's lives. That's the impact UNC Health and the UNC School of Medicine work to deliver every day. Our 40,000 team members across the state of North Carolina are committed to caring for you, our patients and communities, as well as educating the next generation of healthcare professionals. Individually, we can do a little, but collectively, we can do a lot to create impact.